and all that, always they remember that, sir, you have to be there for our students, and it is a great honor for me also. And thank you all of you, all the management also, and welcome students. Today we'll be talking on the subject that is Parkinson's, and Parkinson's is a neurological disorder. As sir told that I am working here in AIIMS in Department of Neurology, and since last 20 years. So neurology is my favorite subject. Stroke, especially, and Parkinson's. We'll talk today. So I will just share the screen. I think screen. Please enable the screen sharing. Just enable the screen sharing because he is showing the participant screen sharing. Dr. Can you hear me? Hello.
Yes, sir. Yes, sir. You can do it now, sir.
Yes, thank you. So Parkinson's. What is Parkinson's? You all know that it is a progressive disease, and this is characterized by slowness of the movement, balance problem, coordination, and it is a progressive disease which worsens with the time, and usually gradually with the time the subject becomes you can say that the time comes that he may be bedridden also. So our role in Parkinson's is very important in making the subject agile, mobile, or you can say that he we help in living a good quality of life with our treatment, that is the physiotherapy treatment. So when we will go through the gender-wise, then we will see that 50% of the cases we will see more in the men than a woman. Because, and it has been seen in many of the diseases that pathology, when it is taken either in the stroke also, or you can say in this present pandemic where COVID is going on. The research has proven that 20% COVID is more in men than women. And in stroke also this is happening, and maybe due to the hormonal factor and everything, and other things are there. So this may be contributing to the less involvement of the females in the diseases. So 50% we will see that in Parkinson's, men are more affected than women, and it is a disease of elderly. Onset of the Parkinson is generally after 60 years, that is 90 to 95%, but nowadays, due to increase in the stress level, due to increase in the pollution and everything, it has been seen that young onset of Parkinson is also on rise. I can say that earlier it was 2 to 5%, but now 10 to 15% cases are age group of 45 to 50 years. Even juvenile Parkinson's is also nowadays seen, and that is also 3 to 5% of the total Parkinson's disease. So the early onset is we can say that if any genetic, when we talk of pathophysiology, then when genetic aspect is taken, then 20 to 30% they say that if family history or genetic thing is there in the Parkinson's, then the subject have a more probability of having the Parkinson's disease. And if we go through the pathophysiology, then what happens that neurochemical, you can say, is being secreted in the brain, and that is in the brain part known as basal ganglia, especially the part of basal ganglia is the substantia nigra, where dopamine is being secreted, which combines with the neuromuscular junction with other neurochemical that is known as acetylcholine, and which with the help of these two we get the control in the movement of the body. So in substantia nigra, it said that there is accumulation of Lewy bodies. Lewy body is a type of harmful protein which accumulates in the brain, and it hampers the secretion of the dopamine, and this leads to the Parkinson's disease. And there is a selective loss of dopaminergic neurons, and due to that, there is impairment in the motor control of person who are suffering with the Parkinson's disease. Parkinson's disease is generally, you can say that there are four cardinal signs for which by which it is being characterized. One is the bradykinesia. Bradykinesia, you know that it is slow. Kinesia is the movement. So bradykinesia is slowness of movement, and this is known as the negative feature of the Parkinson's disease, as per the one scientist there, Jackson. He developed this principle, and by this principle, he said that bradykinesia is the negative aspect of the Parkinson's, because what happens that it arrests the movement, it decreases the amplitude, the intensity of the movement, it increases the length of the time of performing any task, it decreases the intensity of contraction, and this leads to plenty of time taken by the subject to perform any of the activity. So he said that this mechanism of bradykinesia is a negative feature, and it slows the movement. The other cardinal symptom is muscular rigidity. Rigidity is of also three types, and it has been considered as a positive aspect of the Parkinson's disease. Why positive? Because we need to have tone in the muscle to have any movement, and rigidity is increased tone of the muscle in both the aspects, that is the agonist and antagonist, or the flexor or extensor aspect of the body, and muscle group, flexor and extensor or agonist antagonist of the muscle group. And this muscular rigidity, though because this rigidity is there in both the sides, but though the tone is there, and tone is needed for the movement, so it helps in getting some amount of movement in the body. So muscular rigidity has been considered as the positive aspect of the Parkinson's disease in terms of tone. But due to increased tone in both the aspects of the muscle group, it hampers the movement of the agonist or the antagonist. Then it is also three types. That is, one is the lead pipe type. You see the lead pipe, the movement in that, what you will feel when you will flex the elbow, then you will feel throughout resistance in the movement of flexion as well as extension. So this you can say that it is a lead pipe type of movement. As you will bend a lead pipe, it will smoothly bend with some resistance. So this is known as lead pipe type of movement. Then is the cogwheel type. Cogwheel type means first 5 degrees you will feel there is a firmness, and another 5 degrees you will feel the resistance while flexing the elbow. So this on and off of the resistance is known as cogwheel type of movement. Then is the akinesia. Akinesia is the involuntary movement. You will see that some Parkinson's patient will be having a movement which he is not able to control. It is the involuntary movement. His hands will be moving backward by either in the flexion or in the abduction direction, or if you go in the extension direction. Then is the other cardinal symptom, that is the feature you can say, which tremor. Tremor, two types tremor. One is the resting tremor, means when the hand or the limb or the face or the body is in rest, then there will be tremors in the hand. As soon as he will start the function, then the tremor will be absent. When it is existing in the function also, or to performing any task also, then that tremor is known as functional tremor. So there are two types of tremor. Then the next cardinal feature is the postural instability, because all these above things, bradykinesia, muscular rigidity, resting tremors, leads to the stooping of the posture, and this stooping of the posture further leads to the instability in the posture, and then in some stages of the Parkinson's, especially in the stage 3, or you can say in 4, the subject tends to have a fall history on regularly. He will be having fall. So these are the cardinal signs, and these are known as the movement disorder, because this happens in the movement, or you can say this is the motor function which is impaired in the Parkinson's disease. Symptoms of Parkinson's and rate of progression will differ from individual to individual. Earlier symptom of Parkinson's disease are stubble and occur gradually, slowly, and gradually it will occur. So first it will be there. So, what happens that the face will be as such a mask-like face. The initial symptoms, there will be frowning at this face, that cheeks and all that will be puffy. These things are the initial symptoms for the Parkinson's. Then slowly and gradually it will the writing will be cramped. Then the subject voice will be very slow. He will be not able to speak properly, or he will speak very softly, or because the muscle tone is increased, so he is having problem in the speech also. Tremors will be seen first in the fingers. He will be having difficulty. The earlier he used to get up from the chair within 10 seconds, then he will take 20 to 30 seconds. So the length of duration of performing the task will increase, and these things are generally noticed by the close associates, like close friends, close family members, because the subject who is suffering from the Parkinson's disease will not be able to notice that he is having such type of problem. But the other person who is in close contact with the subject can notice that, oh, earlier he used to do this very finely, smoothly, and with less time. Now he's taking time. So these things may be noticed, and when it is noticed, if one is having idea, family members notice it, and then they can go to the doctor and then can start the treatment after the investigations, all that, which confirms the diagnosis. So when the symptoms first begin from the one side of the body, then the other limb, and the other side of the body, sometimes it is only on the same one side of the body, and as it worsens, then it may go to the other side of the body also. So many people with Parkinson know that prior to experiencing stiffness and tremor, so they have some other problem also, and these problems are known as non-motor functions impairment. Motor function impairment is fine, but non-motor function is also there, and this non-motor function is known to be earlier sign in the Parkinson's disease, such as sleep problem, constipation, decreased ability to smell, restless syndrome. These things can be considered the non-motor symptoms. According to the functional aspect, the subject of Parkinson has been divided into the stages. As per the patient's ability to do the function, this stages has been decided, and there are 4 stages, and this stage has been decided by the AN and AR stages of Parkinson's disease. It is known as ON and yeah, they designed this stage. And in this stage, as for the symptoms, stage 1 is there. During this, what happens that subject is able to perform the movement without any difficulty, though the symptoms are there, but he will be able to perform his activity of daily living independently and without any difficulty with mild symptoms. So these stages can be, if you are seeing that the subject is able to walk properly, then all the movements are coordinated, though there are symptoms, but the movements are coordinated, then you can rate the subject as stage 1 of the Parkinson's disease. Then in stage 2, it gets worsens, tremors increases, rigidity, movement, both side walking problem, posture problem may be apparent. Maybe you will see that the subject is a little bit stooped, and he may be able to perform the task independently, but the length and the duration and the difficulty in performing the task increases. So suppose if you are doing some time up, go and tuck test you are doing. So you will ask the subject to get up from the chair and walk for a meter and then come back to the chair. Generally, a normal person will take 10 to 15 seconds to perform this task. But here, even the initiation of the from getting up the chair also may take 20 to 30 seconds. So the length will increase and he will have some difficulty in getting up. Then you can stage this subject as stage 2 of the Parkinson's disease. Then stage 3, this stage is known as mid stage of the Parkinson's, where the subject can live independently, but he will need some assistance in performing finer tasks. Some finer tasks he wants to do, such as he wants to dress, he wants to eat. So grasping and learn dot will be weak. He wants to write, he will not be able to write properly. Even for the walking, he will walk independently, but what will happen that initially he will need some little bit mild support, any support of the wall or side bar of the chair. So this can be termed as stage 3 of the Parkinson's disease. Then stage 4. Stage 4 is the severe limiting of the functional aspect, where the subject needs assistance to do each and every activity. So he will be not living independently, and he will need some amount of assistance in doing each and every activity. So this can be termed as stage 4. And stage 5, what happens that is here a patient is not able to perform or do any of the tasks on his own, and he will need a person to perform any of his areas also for activity of daily living for his daily life, because he needs nursing round the clock and he is nearly bedridden or wheelchair bound. So stage 5, this is the stage where you can say the movement freezes. It actually freezes, means that he is not able to move his limb at all. Stage 5 is one of the worst condition, and this becomes very challengeable to treat as a physiotherapist, because the rigidity is very high, the stiffness is very high. Then at this time of movement, we have to see for the on and off phase of the subject. On and off phase is a term which has been given in the Parkinson subject on the basis of effect of the drug. What happens that whatever the medication is being given, such as dopamine is there, Sanjin is there, most of these drugs are there. So these type of drugs is there, and how much is it, how much time it is affecting or acting on the subject is very important. What happens that sometimes medicine has been given to the subject, and for it is affecting him to live for 2 to 3 hours. So within that 2 to 3 hours, what he will do, he will be able to perform his task, do his task, because the effect of drug is there. This phase is known as on phase, and as the drug starts wearing off, then the subject freezes, his movement freezes, and he is not able to perform any of the movement. So it is known as off phase. As soon as the drug given, the subject is able to do some amount of functional task, perform functional task. This is the on phase, and as the drug starts wearing off, then that is the off phase. So on and off phase is very important for us also as a physiotherapist, because we should synchronize our treatment, especially in stage 4 and stage 5, with the medication time. Because that time we need to have the flexibility of the muscle, we need to maintain the joint properties, we need to maintain the movement of the joints. So that time the exercises may help him maintaining these things or these properties of the muscle as well as the. So as I said, PD is a movement disorder. Non-movement disorder is also there. Non-motor movements I have discussed earlier also with you, that there may be some loss of smell, excessive sweating, constipation, vision problem, weight loss. These things may be there. So this is known as non-motor functions of the Parkinson's disease, and it is the early symptom of the, or you can consider as the early sign of the Parkinson's disease. One more rating scale is there in Parkinson's disease, that is the Unified Parkinson's Disease Rating Scale. Short form is known as UPDRS. This is also based on the functional aspect of the Parkinson's disease, and it is a very vast tool to know the functional aspect, or you can say the functional impairment of the Parkinson's disease. Basically, one who is going through the research and who wants to know the exact functional outcome in the subject of the Parkinson's disease, this scale is widely used in designing the research projects. So, Unified Parkinson's Disease Ratings tool is to follow the longitudinal course of the Parkinson's disease. It is made up of mental behavior. Mental behavior is also rated in this. ADLs is also rated in this. Then motor sections are there. So a lot of things are there in this. And overall, the score is 199. Every score, every rating scale means every function is there, such as mental behavior is being assessed, ADL is being assessed, motor sections is being assessed, speech, libation, depression, thought disorders, dressing, hygiene, walking, tremor, these all are rated in this scale, and the rating starts from 0 to 4. So 0 is the normal, 1 is the mild slowing or reduction in the amplitude, that is delay in performing the task. Then second is the moderate impairment, definitely, and earlier fatigue may have occasional arrest in the movement. So this you can say as a stage 3 of the Parkinson's disease will have 2 rating in the UPDRS scale. Severely impaired frequent hesitation, initiation, movement, that stage 4 can be given the rating as 3, and barely can perform tasks. Stage 5 can be given as the stage 5 can be given rating as 4. So overall, depending upon all of the functional aspect, the total score is 199. If one scores 199, that means he is having worse functional impairment. And if one is having 0 rating, then we can say that he is having good functional impairment. Though impairment is there, but he is able to perform his task with the ease in the symptoms also. So UPDRS scale is very valuable tool in assessing the ADLs of the Parkinson's disease or the function aspect of the Parkinson's disease subject. So this I think I have considered it. So when we go through the physiotherapy management, so physiotherapy management is basically focusing on the neuroprotecting or the endurance or motor learning principle approaches. What happens that here the mental, imaginary, and dual task treatment exercises are very important in Parkinson's disease, because what happens that the subject of Parkinson's disease is having a great problem in performing dual tasks. If you are a subject is walking, and if you will ask simple question that calculate calculate 5 plus 3, he will be having a means tendency to fall, because the mental task came and the physical task came. So he is not able to do the dual task at the time, or he is walking and you will suddenly ask him to catch the ball. what with us, what happens if we are walking also, if somebody throws the ball, we are able to catch it, or we try to move away from that and we balance ourselves. But here the subject may have fall. So this type of exercise, mental cognition level has to be improved. So mental exercises is to be given, means while giving the exercises, give in such a way that subject is doing some mental activity also, and it should progress slowly and gradually. Initially, we have not to start with the dual task. We should go from simpler to much heavier tasks. We first will ask to do simple movements, simple tasks, and then we will move to some heavier tasks later on. So physiotherapy in group also has been found that in Parkinson's disease, if we give group therapy, that has also been considered very beneficial for them, and especially in the stage 3 or 4, it's very much helpful in maintaining the movement and the flexibility, balance, and everything. And it also improves the cognition level while we are giving in the group therapy. So one more thing is there in when we go for the medical treatment, apart from the medicine and all that, surgical process is being done, and that surgical process is known as DBS. DBS is the deep brain stimulation. D stands for deep, B stands for brain, and S stands for stimulation. So what happens that especially in stage 4 and stage 5, or when there is akinesia in the Parkinson's, involuntary movements are there, then the surgeons or the physicians do consider that this person is suitable for the DBS, and they do their DBS. DBS is a surgically implant electrode into the brain, which connects this small electrical device implanted in the chest. So one device is there in the brain, that electrode, and electrical device to program the that function of the brain with the electrode, because it gives an stimulation and that helps in releasing the dopamine. And when this is released, then there is control in the movement, and it has been helpful in especially stage 4 and 5, and the subject who is having severe akinesia. So then this DBS is done. One programming do take time, and there is a lot of trials before that, setting of this programming. And as the time goes, we have to reprogram the that device, because as the tremors and the rigidity and slowness of movement increases, then after 3-4 years again we have to reprogram it, and there is a remote control with the electrode which is placed in the chest, which is connected with the brain, and that do helps in programming the movement of the subject. So they do help in some patients, and it is widely in practice. And AIIMS also we do practice, and DBS is being considered in stage 4 and 5, and the cases where akinesia is higher, on the higher side of the Parkinson's disease. So when PT management should be given, then we have to concentrate more on the muscular flexibility. Thoracic expansion is important, because stoop posture is there. This leads to the decrease in the vital capacity, and that leads to the deconditioning of the chest. So we have to work on thoracic expansion, because we need to have a good vital capacity of the lungs also, and thoracic expansion. Then it gives space to the diaphragmatic muscles also to work maximum to its maximum capacity for better vital capacity of the lungs. So which will lead to the subject to live an active life. So our role is to prevent contracture, deformity, stiffness of joint, and etc. So physiotherapy, and just can say that it helps to improve the mobility, flexibility, strength, gait, speed, aerobic capacity, finally leading into the good quality of life. So I will show you one video of exercises and endurance exercises, what we can do, and some stretching exercises, what we can do, and that can be helpful for you in treating the subject of the Parkinson's disease. There are a lot of exercises, but these exercises are general exercises which you can see and get an idea. So everybody is able to see the video. Can you let me know?
Yes, sir. It's fine, sir.
exercises which can be performed with standing and the stretching, and a lot of exercises regarding to balance is there, and for that specific those exercises which should concern our physiotherapists are much more oriented about these exercises. This was all about the exercises and the Parkinson's disease. Apart from this, the practical exercises and all that has been practiced so that you can practice it. I think most of you must be aware of the practical exercises, which is the coordination. So those exercises can be done, and that is very much helpful in making the subject lead a good quality of life. So now I will come to the second part of this topic is the recent advancement. And in recent advancement, we can see that nowadays a lot of virtual reality, artificial intelligence things are used. So as you all know that you must be aware, we all are using the artificial intelligence in our day-to-day life now. Now that the thing is that our mobile phone itself is a example of artificial intelligence, where we can save the data, we can explore the things. There is Google Talk is there, Google Search is there. These things you can say that is a part of artificial intelligence only. And nowadays, things like cloud computing and all things are coming, where we can store the data and we can run in any of the other devices for our benefit, or we can say that for our use. So the computer science defines the artificial intelligence. We go by the definition wise that any device that perceives its environment and take actions that maximize its chance of successfully achieving its goal. A more elaborate definition characterizes the artificial intelligence as a system ability to collect, interpret external data, to learn from such data, and to use those learning to achieve specific goal and task through flexible adaptation. So the artificial intelligence knows to interpret the external data, means externally what is happening and how the that artificial intelligence or that software should work, that it is in you can say in the line of external data. So this helps in getting good specific task-oriented goals with flexible adaptation. So I will show you some videos also regarding this, that how this works, and before this, how it has been helpful in gaining for that research, that in assessment in time of good test, UPDRS scale, functional gait assessment, work balance test, pre and post-treatment it is done, pre-treatment it is done with the artificial intelligence, virtual reality with artificial intelligence, and then post also you can do, and we can find that how much improvement is there, and certainly the lot of research showed that the improvement was definitely on the cards. So how it works, suppose for the gate environment you want to use the artificial intelligence with virtual reality. So we need to have virtual reality also for better outcome of the subject. Artificial intelligence gives a very fine tuning to the virtual reality. So when we go to a gate lab of virtual reality with artificial intelligence, then we'll see that if number one, you are seeing that this is a 6x10 foot treadmill. You can see this is the treadmill, and if you go second number, then there is a 3 8x8 camera. 3 cameras are there. This gives the impact of virtual reality. So the person will feel that he is working in a field where some even surfaces there, some odd surfaces are there. Though he is walking on the treadmill, but he will feel that he is walking on odd and even surfaces. So that accordingly the data is interpreted and by externally, and then internally also it is being motion is being given to the subject. Then number 3, if you will see the 7 camera icon capture system is there. Here you can see these cameras are there to capture the movement, and a harness is there to maintain the stability, because what happens initially the subject there is postural instability, especially in stage 3 and the stage 4 Parkinson's disease. So harness is being harness, the subject is in harness. As slowly and gradually he has the improvement in the flexibility increases, the movement increases, the postural stability increases, then we can mean of the harness. So we will show you the video also. We will get a better picture in this video. Clarity will be there. Able to see the video? The sound?
Sandy Williams is buckled up and ready for action. It looks and feels like she's part of a video game, but it's actually high-tech rehab for her Parkinson's disease.
So here she is walking on a treadmill, but she will feel as if she is walking in the environment
for that to occur.
And this is the dual task. She is doing the dual task. She is hitting also an object, which is interpreted by the external data and movement. So this is the artificial intelligence.
The video screen completely immerses the patient into a real-life scenario.
You want to go over like a little hill, you feel it. Rather than just having the patient walk or an individual walk up and down, mechanical practice. Now what we need is we can change the environment in a very dynamic.
And now the environment has been changed, dynamic environment.
Feedback during weekly appointments at Cleveland Clinic. Sandy works with her therapist on gait and increasing stride length by touching her toe to a box. Other times, she's asked to target curves and butterflies.
This is a dual task by asking him to perform the hit the bird.
But I do enjoy the challenges. Can I get them? One
Now she is walking without the harness, you can see. Because she has improved the gait also, posture also, stability also. So she was working in the without the harness. So this will give you the clear picture how it works. So this was for the gait, and then I will show you another video that how the data is interpreted externally through magnetometer, through accelerometer, through gyrometer, and the sensors. The sensors used was wire sensors and the laser sensor. What was the benefit of the laser sensor? What was the drawback of the laser sensor? Accuracy and all that they have shown in this video. So you can see this also. Doing rotational exercises, this is being interpreted externally, and then the data is being internally also
patients exercise uses various letters, tremors, halted gait, and lack
being
of balance.
exerted by the system also.
CSF study to see if special video games could replace regular exercises. The therapeutic games are the result of a marriage between game developers and scientific researchers. CSF
had developed a series of exercise programs for patients with Parkinson's. And they asked us if we could actually make a video of it. And we said, there's this new thing called the Wii. Why don't we make interactive games?
CSF researchers thought video games might be a welcome change of pace for physical therapy, which can be tedious. People very much like doing games. They can be engaging, fun, and therapeutic. But developing games that would know if patients were using the right muscles in the right way was tricky.
Yes.
Health games need to detect the player's movements much more precisely than their
It is
consumer
detected by the artificial intelligence and movement.
To be able to sense where you are in a particular space. One is, can I sell louder? Am I moving a particular
These
direction?
are the things which
Another one is a gyroscope,
detect the
which direction am I pointing? And then you need something like it to say, okay, I need a rock star outdoors. That's what I can talk about.
These three technologies enable smart devices to do this. To make the technology more accurate, the developers created suits built-in sensors. Battery operated suits were awkward and cumbersome, so the developers turned to camera technology. It's baby with infrared light, and then taking that information and using some very clever software to say, you just raised your hand. The camera technology does not need to be worn, but it's not as accurate as the sensors. Each one has good pluses and minuses. We're looking at actually trying to perform a fusion between those two technologies. Study showed that despite their physical limitations, Parkinson's patients could successfully play the games at home, and they did them more often because they enjoyed them and they helped. It was a fun way and an easy way to exercise, in my own room at any time. I felt better. I felt more normal, more fluid, looser. In fact, the study found that after playing the games for 12 weeks, 65% of patients had longer strides, 55% had increased gait velocity, and 55% also reported improved balance. The hope is that if we can engage people in physical activity early in the disease course, that we might actually be able to delay progression. The therapeutic games could be available to the public as early as next fall.
Early intervention, the treatment can lead to delay in the progression, and this may help us a good outcome, good functional outcome in Parkinson's patients. So these type of things, I think, the era is coming, the time is coming that much of artificial intelligence, virtual reality will be used as we are in this pandemic. Also, we are seeing that we are attached to virtually now. Tele-rehab, tele-physiotherapy will be also one of the aspects which will be coming in coming days. So these things will be very much helpful for us and for the patients also. I think initially the cost may be higher, slowly and gradually as it will come in use, the cost will also decrease, and it may be becoming affordable for us or for the Indian community or the Indian patients, because we know that a lot of the population is of such a class that they can't afford this. But in the meantime, the coming time, it may be affordable for all of us. And as our Prime Minister is also pushing for Make in India, and the things and our scientists and our researchers may come up with these type of devices in India. So with the rapid development of the sensor technology, cloud computing, and internet mobile services, e-health, mobile, development of telemedical system, monitor vital signs and psychological signals, including cardiogram, electromyography. These things will be measured. You can say that they will have that they will have not to come to the hospital from home only. They can measure it through this artificial intelligence, and then the doctor may see, and then accordingly he may prescribe the drugs and all that. So it may be in the next 10 decades, there may be some revolution in the healthcare, in the sector of medicine, or you can say that rehabilitation for our part. Also, the telephysiotherapy will be much more in talking. So we are having some more devices for measuring also. Measuring of tremors, gait patterns, and the movement. There are devices which will help us in having good quality researches, such as you can see that this is the device which measures the tremors of the hand and how much tremors in a minute the subject is having, and after the treatment how much it is reduced. And another one in B, you can see that here it will measure the initiation, that how much time is taking to initiate the movement, or the stride level, how much cadence is taking. These type of measuring devices is will come through, and this is the example of the artificial intelligence. So in coming years, with the advancement of technology, the measuring of Parkinson's rehabilitation will grow significantly, and this will help in better research, better outcome, and definitely help the subject and help the subject in better functional outcome also, and then it will help definitely in them to lead a good, active quality of life. Thank you very much. for the patient hearing. I hope that this lecture would have been of great help to you all.
Thank you so
Inquiry
much,
is
sir,
there,
for your
sir?
valuable time.
Yeah.
And today I also learned some of the thing about Parkinsonism. Most of the time, I always run behind the neurological conditions because I'm from a sports backfield. So today I learned something about Parkinsonism, its types, and your mobility exercises was very good. And the way you presented with the TheraBand is really appreciable. So first time I'm attending your actually online webinar.
Yeah.
It's amazing, really
Thank you,
amazing.
sir. Thanks.
And
And any
the way
queries
you
there from the student side?
uh, so actually today only we actually inform the students because for the so many days it is not that confirmed from the management side.
Uh-huh.
So that's why very less students they participated today.
Okay.
So, but that your virtual reality videos are really good. So those who
This
are
is
not
like
attended
something that we should know that what is going on and how much it
recent
may come
advances,
and impact in later stages of our planning and treatment of the subject. So that's why
really,
this
really.
topic, and I think it is helping. It must be helping at least those who have participated here in this.
Yes, really. The who are not attended this, they are really going to miss something important in physiotherapy. That to be advanced physiotherapy techniques.
Anything, sir.
Really.
If you want that once more, I can take this lecture. No problem in that. Whenever you plan.
Sure, sure, sure. It's we are honored for that, sir.
Thank you,
Thank you.
Dr. Arun, and
No,
to
no. Uh,
everybody. Uh,
I thank you from our whole SBS family for your precious time you given to us. And thank you so much, sir.
Thank you, sir. Thank you. Yes.